I'm Marion Broom, and I'm the Ruby Wilson Professor of Nursing and Dean of the Duke University School of Nursing. I'm also the Vice Chancellor for Nursing Affairs at Duke University and the Associate Vice President for Nursing Affairs at Duke University Health System.
Hi, I'm Barbara Turner. I'm the Elizabeth B. Haynes Professor of Nursing here at Duke University School of Nursing, and Dean Broom and I are the co-directors of the Executive Leadership Specialty in the DNP program.
It is built and actually integrated into the Doctor of Nursing Practice program, which, as you know, is building and shaping leaders for the future that can make changes within healthcare systems to be more responsive to the needs of patients and improve patient care delivery. So the ELS is specific for those individuals who are placed throughout health systems, out into the community, into clinics, into specialty areas that are actually expected to lead at an executive level, who are working with other executives from other disciplines to transform healthcare. And so it's really for someone who's had significant experience throughout the organization or across those settings.
The reason we initiated this is in the first 10 years of our DNP program, we had a number of CNOs, Chief Nursing Officers, or other nurses at an executive level who said, the DNP program is great, but you know what? I've had that kind of finance before. I've had that leadership before. I'm looking for something over and above what is in your current DNP program. Could you think about something for executive nurse leaders? And based on the comments from our exit surveys as well as surveys of students that were in the program, we said, you know what, you're right. You're right. And we brought together a team of nurse executives from across the country to help us design this program so that it would be contemporary and address the issues that you actually face in that kind of a position.
Well, because a lot of nurses at this point who had master's degrees in nursing would think about perhaps another master's degree, an MBA. And they would do that because they thought they needed that information in terms of management and finance, et cetera. And although that's true, the reality is we can offer some of those courses and gear it to the actual issues that they are dealing with within healthcare. A good example would be financial management. And when you're managing finances related to designing, evaluating, and testing innovative care models, you really have to talk about that from the perspective of a variety of constituencies. How is it going to affect, what kind of staff do you need? How is it going to affect patient outcomes? How are you going to educate or train the different professionals to work together to design and shape and evaluate these models?
The value of this ELS is that it is cohort model. So we are admitting small cohorts of 10 to 15 students in which they come together and they share their expertise. And these are people that are chief nursing officers and high-level healthcare executives across the nation who will come together and really learn from each other, as well as learn from the experts, and share their common issues and problems for problem solving. So we're very excited about this first cohort. I think the ideal candidate is someone who has some clinical practice behind them, but has moved into a leadership role and has decided, I really like this kind of leadership role, and I need more information. I need a lot more education in this leadership, and therefore we're looking for people who have had some finance experience, some leadership experience, and have been at an executive level for somewhere between 5 to 10 years. Those are the people that, when we bring them together, create a richness in the discussion and a learning from each other.
I think the ideal candidate is someone who has several years clinical experience with a particular population, but more than that. They then have developed themselves or been recognized as emerging leaders and have moved into positions where they've been given more responsibility for different care models or different individuals on care teams, and they've all of a sudden realized they're really good at this. They're good at leading people, but they also realize I need a lot more skills than I actually have that I've obtained in my master's degree, and most of our master's degrees, not all, but most of them are clinically focused. But even if you have, for instance, an informatics degree, which is an excellent master's degree to build the DNP on, you still also don't have the executive leadership, the effective leadership strategies. You haven't necessarily had the data analytics strategies that you need to be able to look at different sources of data and how will that inform the decisions that you're making. So I think this is an attempt to differentiate for individual students learning activities and knowledge and skills that they're going to need as they advance their career as a nurse executive. Well, I think because as you know, we're the #1 doctoral program in the country in terms of DNP. And I think they need to know that this is an active engagement on their part as a student. We do not just feed them content. We expect that they will develop their own ways, objectives, goals in the program, and that we will work with them side by side, the faculty will, to stretch them, to challenge them, but also to address their specific learning needs. But to do that, they have to put a considerable amount of time into figuring out what is it I really need, and working with their advisor and on their project to really shape their own educational experience. But we are there the entire time, and we are there to challenge them. But we want them to own their own knowledge and skills when they leave here.
There's very few, if any, other programs in the United States, and so we are addressing a market need. In addition, we have such expertise available to us, not just here at Duke, but from our advisory boards and our alumni who really want to make this program be a success. And so I think it's going to be a very unique program. We know from our first year that it's a hugely popular program.